After the meeting of the governors and the president ended a week ago, information on the health sector agreements have hinted to an intent for counties to stop hiring health workers according to their prior agreements.
What we are saying here today as the unions in the health sector is that we reject the resolution to extend the contracts for UHC staff for the next 3 years.
This has come at a time when we expected these healthcare workers to be absorbed into permanent and pensionable terms, and the resolution from the summit can only mean that all these close to 9,000 workers will continue to suffer discrimination and prejudice.
Health unions in the country are strongly opposing the government's decision to extend the contracts of UHC workers for another 3 years.
So imagine you hire somebody from college, they learn all the tricks, they learn everything in that hospital about the patients. Then after 3 years you take them away, you bring another group, they learn again, then you make them jobless. Sacks you because you are a cousin to this governor who is now no longer there, another one is coming. It's very unfair. Then as she has said very well, that you do the same work, different pay. Njaa ya permanent and pensionable njaa ya contract. Fees ya PNP, fees ya UHC.
This comes after reports that the chair of the Council of Governors, Waiguru, in a communication is yet to subject 9,000 health workers employment on an extension of 3 years.
Today is 14th February, a day of love, spreading love. And as healthcare workers, how we do that best is by taking care of our patients. And we cannot do that when we are demoralized, when we are not motivated.
You cannot say you want to care about the life of Asuras. Well, as we know very well, we are the people who serve those Asuras down the cloud. When healthcare workers are mistreated, the Asuras suffer. When we withdraw services from our hospitals, who suffer? The common mwananchi, the Asura. Governors have the attitude to go to outside the country, to very big hospitals. But what about the Asuras?
According to the union, this was against their demand of permanent and pensionable conditions.
Now we are wondering, if you cannot absorb 9,000 healthcare workers, you want to extend the contract, can you also employ 20,000 healthcare workers contained in your manifesto? I think we are being lied to. Tunadanganywa na tunajua.
Because we know very well that the Ministry of Health through the CS had declared to put these officers on permanent and pensionable. The act of the Council of Governors to twist the national government to put these people on contract, which is against the existing laws.
Because we know very clearly we had people in that conference in Naivasha who told us what went about. The Ministry of Health, national government was very, very open to changing the terms to PNP. It is the governors who refused that. Early next week, on a day that we are going to communicate, all the leaders of the health unions in the health sector, we are going to walk and invoke Article 37 of the Constitution, and we shall be demanding to have a sitting with the CS Health so that we can be able to resolve these things. And if that will fail, then you know that we are of course going to communicate a date on when we are going to call our members to go on strike.
The Ministry of Health previously had agreed that the workers be employed under permanent and pensionable conditions, a move that has seen Secretary General for Nurses, Seth Panyako, pleading with the President to reconsider CBA agreements made earlier.
But today, as I'm talking here, we were said to issue a press statement to oppose the government decision to renew contracts for health workers within the health sector. But as I go out, I'll be telling them I have spoken to the president direct. The president cannot again in the evening see me on TV. I am opposing I'm rather asking Your Excellency to ask the Minister of Health, Chair of Council of Governors, the Minister of Labor, to call us the health workers so that the issue of renewing these health workers on another 3 years, making them 6 years on contract, we are actually making their life in retirement very poor because they are not deducting any pension scheme for them. That is something that we are requesting. I will be telling them when immediately I come from this place that I will not be in a press conference because I can't speak to the president, then he sees me opposing the decision he has made.
For Ebru TV, Amude Francis.